Hello guys, welcome back again to my channel. In case this is the first time you're seeing me, I'm Anikan MD. For today's video, I'm going to be explaining how 400 level works. Yeah, I'm going to be using my school, University of Jos Plateau State, as a case study. Please note that calendars for medical schools and how they run this class varies from school to school. Why I'm filming this video is because when I was coming into this level, I watched so much videos on YouTube because I just wanted to have an idea of how the school runs this program. Aside from reaching out to senior colleagues and all of that, I just wanted to have that holistic idea of what the class was about, how long is the class, like how much courses am I doing in the class, what to do for each of the courses in the class. So first off, the 400 level class in our school, take note, in my school, runs for roughly 13 to 14 months. So you're spending a year and some months plus in this class. So this class happens to be one of the longest of classes, where you do both clinical medicine as well as your laboratory medicine. It is popularly called as the laboratory medicine class because you're taking courses such as pathology and pharmacology. And if you're in my type of school, you don't only take those ones, you also take clinical medicine courses like medicine and surgery. So medicine and surgery are final year courses, but you start doing them in 400 level. And also community medicine, I forgot to mention, you also take community medicine. I'm sure you probably, like I said, it varies from school to school. For our school, you do a bit of community medicine in your preclinical arm. When you come over to clinicals, you still do community medicine. So basically, this class, you're doing pathology, you're doing pharmacology, you're doing medicine, you're doing surgery, and you're doing community medicine, right? I hope this is clear. Now, for the pathology is further divided into 4 courses. You do histopathology, you do medical microbiology, you do chemical pathology, and you also do hematology. If you fail one of the pathologies, you have to repeat all 4. Like it was a all for one for all kind of case. So if you fail histopathology, you have to repeat histopathology, medical microbiology, chemical pathology, hematology. Like they were 4 brothers that are chained as one, even if they are separate departments on its own, right? So that's what makes it kind of tougher, because if you fail one, you repeat all. Then pharmacology stood as a separate department on its own. Now guys, for our school, for the whole of the 10 months out of the 14 months that you spend those 10 months also doing medicine and surgery. So for medicine and surgery, you would run your medicine and surgery program like a typical final year student that is taking these courses, because you would do your clinical postings with them most of the time, and also you would have classes, right? That is usually in the mornings. So basically, you do, for our school, you do M0, S0, which is 4 weeks each. So what happens is that at the end of M0, you switch after spending 4 weeks in your M0 posting. That is your introductory medicine posting. You spend 1 month there. You would now switch with people that are doing S0, which is introductory surgery. Then introductory surgery people will come over to your posting. So it's you guys are switching. So at the end of M0, S0, you have spent 8 weeks in total, 4 weeks for medicine and 4 weeks for surgery. Then you move on to do your M1, S1 posting, which is now a lot longer, because for M1 posting you're spending 8 weeks, for S1 posting you're spending 8 weeks. So 8 weeks plus 8 weeks, in total you're going to be spending 16 weeks. That is for both medicine and surgery altogether. Like I said, it's the same jumbo routine. After the 8 weeks, you all will swap. Then after that, you move to M2, S2 posting. So for M2 and S2 posting, you spend 8 weeks, and in total 16 weeks. So you're doing 16, and 8 weeks. So that is the whole total in which you're going to spend. I think everything totals to 40 weeks in total of doing medicine and surgery. So you would be doing your normal classes in medicine and surgery. You will do your clinical rotations where you're expected to attend theater, you'll be expected to attend calls, and God saves you if you're in a stressful unit, because some units are very stressful. You might have calls every day, so you will have to show up for your everyday calls, and you would also be doing your pathology and pharmacology classes. So that's what makes the class stressful. Not that it is a very difficult class. It's just that it's a very stressful class because you are grappling, because you're struggling with both this medicine and surgery posting, which, like I said, they are like final year courses. I feel like when you even get to the end of M2 S2, you have been taught so many things, to be honest with you. Like I saw our final year exams question. Obviously, when you're in final year, a lot is expected of you. At the end of M0 S0, there are certain things that you're expected to learn, right? Like from S0 S0, which is the introductory posting to medicine and surgery, you're supposed to learn the whole everything about clerking, basically clerking, history taking, talking to patients and all of that. Then you move to M1 S1. At the end of M1 S1, you will now be expected to be able to examine patients. So you'll be able to carry out certain examination, abdominal examination, respiratory examination. Like you'll be expected to carry out some of these musculoskeletal, sometimes CNS. Like I said, depends on the posting you're doing. You're expected to carry out certain examination, right, with the idea that your history taking has been already perfected, right? So you're perfecting that, but your main focus here is like history taking and all of that. Then when you come to M2 S2, you are now expected to carry out, to come up with diagnosis and even management plan, because sometimes, although people will argue that M3 S3 should be the level where you are dealing with a lot of management and treatment, well, for M2 and S2, you'll be expected to know certain investigations, right? So when you're done presenting your history and exam findings, follow-up questions that usually follows is, okay, what investigations will be better suited for this patient? And sometimes they would even ask you the management, like what do you think should be the first line of management for this patient? So basically, at the end of your whole clinical rotation, you will be able to answer final year questions. You might not totally be able to give, because like I said, much more is expected from a final year than you, because they have done so many rotations and their knowledge base is very wide. But to be honest with you, you would have almost like so much knowledge that you can also indulge them, like you can try to manage these patients, right? But like I said, obviously they have much more experience than you, but at the end you can even attempt some of their questions, because you most likely have a lot of theoretical knowledge, because you're being taught so much, from plastics to neurology to, you're doing so much at a time, right? So that is it for medicine and surgery. Now, like I said, your main focus in this class is actually the pathology and pharmacology, because how our school works is that if you don't pass your pathology or pharmacology, you cannot go to the next class. You can fail your medicine and fail your surgery. Don't do that, please don't do that. You are going to face the repercussion in final year, so don't just do that to yourself. But you're not writing exams in medicine and surgery. Instead, you'll be writing basically test upon test upon test, right? So like I said, don't fail that, but you'll be writing test upon test upon test, and some people even end up banging these tests, right? And you are allowed to, nobody is penalizing you, you're allowed to go scot-free, right? But however, for your pathology and pharmacology, it would affect you in that class. Like if you fail any of them, you would be forced to repeat that class. Actually, you are given options to receipts first, then if you fail the receipts, then you'll be made to repeat the class. So you see, most of the bulk of weight is placed on your path and farm, despite the fact that medicine and surgery would be dragging for your attention. They would beg you, they would taunt you, they would stress you with calls upon calls. You will come back very exhausted, but please, always force yourself to read your path and farm, because that is what is going to be the determining factor of whether you go to the next class or not. So at the end of these 10 months out of 14 months, you would stop doing medicine and surgery and you would rotate Like I said, this is peculiar to my school. You get to rotate around the 4 pathology departments. You go to hematology department, where you'll be spending 1 month in the department, figuring out the inner workings of this department, right? It's not so different from what you've been taught in class, but just that within this 1 month, you'll be solely focused on a department. Like if I'm in hematology department, for Monday till Thursday, I would only be doing things associated with hematology. Well, you'll be having morning classes. Morning classes would be your typical normal calendar. So your morning class, your morning class today, maybe you're supposed to have histopathology. The histopathologist will come and teach you. They will teach you for about 2 hours, then they will let you go. From the time they let you go up until the end of the day, you'll be spending time in your supposed posting. So if you're doing hematology, you spend the rest of your day in hematology, from making blood films to carrying out blood examination, from looking at different forms of leukemia under the microscope, and also learning how to diagnose blood malignancies, learning how to diagnose anemia, learning how to treat anemia, learning what are the indications for blood transfusion, learning a lot about transfusion medicine, how to run a blood bank. Like, it is a lot, right? You will be focused on that. Then at the end of this 1 month, you will be expected to write series of end of posting tests. So you write if you're in hematology, you write your end of posting test in hematology, where they will test you over maybe what you have learned over the month and over your years learning hematology. Then after that, you rotate, you go on to the next block. So maybe you go, if your next block is medical microbiology, you go to medical microbiology, where you learn bacteria, you learn viruses, you learn fungi, you learn almost everything in that 1 month. Guys, to be honest, this time is one of the most stressful times. Like, to be honest, I'm not going to lie, but contrary to popular opinion, when I was doing my I started with hematology posting, and hematology posting gave me a bit of, because I missed clinical rounds. I know people don't like that part, but I did like it. I like going for rounds. I like going from bed to bed, discussing patient cases, learning patient management, learning the new treatment plan, the regimen, and all of that. I do like all of those things. So hematology did give us a chance of joining their rounds once a week, so I didn't feel that so much. When I moved on to my next block, I think my next block was chemical pathology. There wasn't an opportunity to actually join their rounds and all of that, so I missed that part. And like I said, it is very stressful, because sometimes you would sit from that time where you resume your blog posting till the end of the day, like you are being bombarded with so much. And how it works is that you teach yourselves, right? So the topics are being shared amongst yourself. Then they will be taking these presentations. So sometimes you'll be expected to make PowerPoint slides. You'll be expected to sometimes print these slides, and you'll be graded, because you always have someone like an examiner coming each day to come and listen to your presentations and correct you where necessary. So on these days, they are usually grading you based on your presentation skills, your PowerPoint, your dressing, a lot of criteria go into this grading. And I think it's important, right? Because you learn how to build your confidence skills, you learn how to speak properly, you learn how to, you learn what is expected for you to make a mind-blowing presentation, right? And like I said, it's very stressful, because sometimes I know, like in microbiology, you could take as much as 15 presentations in a day, so you're sitting throughout, and oh god, it is you'll be exhausted and burnt out. And another thing that makes this time a bit stressful is the fact that you have it in mind that, at the end of this is your exam, so there is more stress to it, because you are forcing yourself. You have to learn what you have to learn now, because after which all of these rotations, it's your exam. So when you're done with that, you move on to the next, you move on to the next, you move till the end of your 4 blocks. In our school, there is no block for pharmacology, so pharmacologists will keep Fridays are for them. Fridays are for pharmacologists. They would come and they will teach you every Friday. It will be like a normal routine for them until they are done with their syllabus. So it is up to you to be going back to the old things and be revising them. Don't be too carried away with your pathology that you forget your pharmacology, because pharmacology is an individual department on its own, and if you fail that one, you have to resit it. So basically, this is just like an inner workings of what this class entailed. Like, it was fun, but it was long, it was annoying, it was stressful, it was filled with tears, pain, suffering, sweat, because of, if you want to do the class properly, you have to put in the work, right? Nobody's going to come put in the work for you. But at the end of this whole class, you're going to come out a fresh and a brand new individual. So guys, I think I was able to do proper justice to what this 400 level class entail. I think I was able to give you a breakdown as to the courses you're doing in these classes. I know I didn't speak much about community medicine because you do that every Friday, and in our school you do that every Friday, and they would teach you, they would give you tests, but you don't write exams. You don't write exams in community medicine in this class. You don't write exams in medicine and surgery in this class, because they are like final year courses, but you start them from 400 level, right? So you don't write exams in it, but you're being bombarded with so much knowledge that you should know, right? For community medicine, you're learning from international health. You're learning so much, actually. At the end of, even food and nutrition, you learn it in community medicine, and at the end of the day, you find out the aim is to make you a more holistic doctor, and not just one that is just centered around medical stuff, right? Because you're what you eat, and the world is changing, so you have to be up to speed with that. So, like, I really hope I've been able to bring justice to these topics. If you have any questions for me, please leave it in the comment section down below, and I would get to it. I would try as much as I can to always be in the comments, responding to each and every one of your question. If you're able to listen up until this point, just comment congratulations. I think for my last post you would have told me congratulations, but like, just comment congratulations for me. Until next time, guys. Bye.